Okay, hello, my people. Welcome to today's office hours session. Dr. Adam Tice here, and today we're going to talk about, of course, more things related to your health. These are things that you need to know, but nobody's telling you, and these are the naturopathic secrets and the pearls and the things that I've learned from being in the clinic over 12 years, and that's what we're doing. We're going to share that stuff. So you guys, let's just see, we're going to talk about thyroid today, but before we do, let me just tell you guys a little bit about what happened. I got a little bit of a shiner here. So I have a 2-year-old, and we were playing rough, and he got me. So that's what's going on there, just if you're wondering. Let's talk about thyroid, guys. So we can't talk about thyroid, or we can't go through a session without talking about digestion. So let's just tie this together, and you know, we will continue our conversation on digestion. And you know, the root level of the inflammation is the digestion, but what's under that? Why is that? What's up with the digestion? Who's in charge of that? How does that happen? So I want to talk a little bit about low thyroid. This is super common. I mean, really common. And we treat a lot of this. I've seen a lot of thyroid, and I'm really comfortable dealing with thyroid stuff. And there's a lot going on. It's a big player in setting the base metabolic rate for the system. And there's some feedback that goes on with the thyroid and the brain that kind of sets that. So, you know, to talk about thyroid, I want to kind of tie that together with metabolism itself, and it's really a derangement of the whole metabolic functioning of the system. And there's something that's called metabolic syndrome, and that is this collection, and this is really sort of, you know, that's the diagnostic term that's used. It's to put on this collection of things that we've been talking about that contribute to inflammation in the system, which are going to then in turn, you know, set a system up, set a person up, set the biology up for chronic inflammation and chronic disease, depending on what the susceptibility is. Okay, we've been talking about that. Susceptibility means like the individual, means the constitution, the genetics, the lifestyle, the karma, the totality of one's life up to that moment in the given time. And then they have symptoms. So the symptoms and the features of metabolic syndrome are unique, and they're clear cut. It has to do with insulin resistance and elevated blood sugars in the system. You will also see high blood pressure, or variations, or kind of or up and down, changing blood pressure. People say sometimes it's high, sometimes it's low, but generally it's kind of what's diagnosed as an essential hypertension, just basically unexplained blood pressure stuff. You will tend to see the obesity. There will be belly fat with this, and difficult losing weight. And then you'll see abnormal lipid panels, abnormal cholesterol panels. You'll see low LDL. You'll see high triglycerides. And then when you put this package together, we call that metabolic syndrome. So, you know, the obesity is a big deal. This is associated with many things, and we know obesity is one of the main drivers for diminished immunity, and we're looking, you know, when there is obesity, basically it's going to increase the risk for everything: heart attack, stroke, diabetes, gallbladder issues, cancer, literally you name it. And if obesity is part of the picture, then it's not going to improve anything. You know, and when we're talking about obesity, that's a big picture is food intolerance and diet and lifestyle. And this is one of these things that the dominant school of medicine doesn't really have too much to offer. They say diet and exercise, and then that's kind of the end of the road there. So, you know, a lot of times diet and exercise alone, it's not gonna be enough, especially if you're trying to play catch up. If you've got 30, 50, 100 pounds to lose and you're just trying to do diet and exercise, I mean, there's some percentage of people that have, you know, the genetics and the constitution and the drive, determination to actually make that happen. But probably 90% of people, they can't make it happen. It won't happen. They won't be able to stick with it and do what we really got to do. In the long term, it'll be, you might be able to kind of muscle through it for a couple of days, couple of weeks, but there's gonna be, basically you're driving with the brakes on, because there's more to the story. And the diet and the exercise, you'll be doing the right things, but you will get discouraged because it won't work, and you will get tired of doing all the right stuff and then feeling like you're torturing yourself because you're not getting you know, the results. And if we don't address the diabetes or the obesity, I mean, it's gonna end up in, I mean, there's gonna be high blood pressure issues, there's gonna be blood sugar issues, there's gonna be lipid issues, you know, and oftentimes these things, if unaddressed, will kind of eventually lead into other more mysterious kind of diagnostic territory where you're gonna end up with something like fibromyalgia or autoimmune issues, you know, and Hashimoto's variation on the low thyroid is really kind of, you're tiptoeing into this territory, and we really got to get ahead of it. So diet and lifestyle are definitely part of it. You know, minerals, you know, this is a big part of what's going on. And so let's just talk a little bit about, I'll say a little bit about minerals because that's such a big picture with the thyroid. But let's look at how's the thyroid working and what's going on with the thyroid here. First of all, the thyroid is going to be setting the basal metabolic rate. So, you know, Broda Barnes is an individual, a medical doctor who did a lot of the work and data collection on this, and taught us about how basal body temperature tracking is really a great, simple way to track the thyroid. And this is something that we can definitely do. It does guide you, and this is one of the things when we do hydro in office, one of the things we're looking at is looking at the initial presentation of a person's body temp, and we track that over time, and you can tell the state. I think it's not only a readout of the thyroid. For me, it's a readout of thyroid output, which is, and then also vitality itself. The body is running cool, then the vitality is not there, and we got to find a way to stimulate that. And one way we're going to do that is by making sure that the thyroid is all the way on, and because that is going to be intimately connected to the immunity and the digestion, and then of course that connection that we've made previously with digestion and absorption, assimilation, elimination, and detoxification, and then setting up that stage. If we don't do those things and those things are not working properly, again, there's your cascade for blood sugar issues, inflammatory issues, and depending on susceptibility, you're going to set yourself up for chronic disease, oftentimes unexplainable in the medical doctor's office. And that's what we're trying to do, is kind of connect the dots. So here's how it goes with the thyroid. The pituitary produces the TSH, which is, pituitary is in the brain, and this is producing the thyroid stimulating hormone, which is the TSH. Now, this is, now when thyroid hormone is converted to, the TSH causes the thyroid to produce thyroid hormone T4, and then we need to actually convert that T4 into T3. That's what's going to happen, like big picture. So when T3 and T4 are present, that's going to send some feedback to the TSH to stop making TSH, and it kind of gives that feedback there to the brain. So if TSH and T4 are in normal ranges, it'll send the feedback and the brain will stop doing that. And so how it goes is, if you have low thyroid, that TSH will go up. And then the opposite's true if it's just to say this, if it's a hyperthyroid, an overactive thyroid, that TSH is going to go way down. It's going to drop down, generally a lot of times close to zero. And TSH can climb, you know, sometimes. And for me, I like to see a TSH in the range of like 1, 2, 3. When it starts to get 3, 4, 5, certainly 2, 3, 4, I start thinking subclinical hypothyroid, need to look and find something. If you're talking 5, 6, 7, 8, 9, 10 or higher than that on a TSH, we already have some catch up and cleanup to do, and we got to go back and go through this flow like I'm about to go through and kind of troubleshoot some of this stuff so we can get the thyroid turned back on and then you know, so the digestion works well and the immune system works well and all these things that we're talking about work well, so we can eliminate a lot of these things. Because here's the thing, thyroid can contribute or mimic or mirror a lot of different conditions. I'm gonna go through, I have some of these just kind of listed out. I just want to read some of these out. I mean, this can be everything from abnormal perspiration to acne to ADD or concentration issues, allergies, hair loss, Alzheimer's, anemia, difficult breathing, calcification of the arteries, weakness, respiratory issues, atherosclerosis, arthritis. I'm just going to cherry pick some of these out here because this list is long, guys. Autism, birth defects, changes in vision, breast cancer, carpal tunnel, changes in blood pressure, chest pains, constipation. I'm skipping over, there's a lot of these here. Dental issues, depression, diabetes, reflux and dyspepsia, eczema, epilepsy, sleepiness, fibromyalgia there, brittle nails, gastrointestinal disturbances, more gum issues, headaches, head pain, heart issues. You guys getting the point? It's literally connected to everything. Let's just keep going through here since we're going. I'm going to cherry pick out what I think are the most common ones. There's hypertension, immunosuppression, impotence, infertility, inflammatory bowel disease, irritability, joint pains, kidney issues, low energy, loss of appetite, low IQ, loss of the ability to loss of spermatogenesis. That means the ability to generate sperm. So this is another fertility issue. Low body weight, mineral insufficiencies, memory loss, mental issues, migraines, head pains, MS, muscle cramps, muscle weakness, nausea, osteoarthritis, so joint pains, bone issues. Guys, this is still going. Should I keep going? Might as well finish it out here. I mean, I'm just cherry picking here. This is so full. It's literally connected to everything. Schizophrenia, scleroderma, more respiratory issues. Lot of stuff, guys. Lot of stuff. Mineral issues. You get it? It's connected to everything. So the thyroid. Another thing that's interesting with the thyroid is it's a little butterfly-shaped gland. It's seated right here, and you know, metaphysically, that is, you know, here in this region, this is the region that is connecting the head and the heart. So without getting too like woo-woo or mystical about the whole thing, there's also that component. This is in the 5th energy center area, so it's going to be connected with communication and the ability to express and be creative and communicate. These are the kind of things. So if there's a suppression there, issue there, we're going to see thyroid issues. But again, I'm trying to keep it really more physical here. And you know what I was going to say here about just the anatomical situation of the thyroid, it's right here, guys. I mean, there's just this little flap of skin here, the neck, that's protecting it from the external environment. So the thyroid is going to be really sensitive and susceptible to any kind of electromagnetic radiation, Wi-Fi, the cell phones, you know, all these things that are environmental, because there's not much of a barrier there to protect that gland. And that's a big deal of what we're talking about, are things like, you know, with certain key minerals, and the thyroid is very prone to become toxic because of its anatomical placement and the key role that it plays. I'm going to say a little bit more about that in just a second, but let's talk a little bit more, just a second, to give you guys some technical info about this TSH, thyroid stimulating hormone, and the T3 and the T4, And if I'm doing for me, a bare bones thyroid lab is TSH, free T4 and free T3. Let's just like see what's going on there. And we also really want to see some other things, reverse T3, because what can happen is the TSH can be it can be okay, and the T4 and the T3 can be okay too. But what happens is you have fake hormone, because if there's fluoride toxicity or if there's synthetic hormone on board, it can basically trick the lab, and this is why we can't hang our hat on labs, because it can make basically thyroid hormone so the blood test can't tell the difference between a thyroid that actually has iodine at the core of it, or if it has fluoride at the core of it. A blood test can't tell that. It just thinks the thyroid hormone is there. So that's where labs might look fine, but under functioning is definitely present, and you can only tell that upon questioning of the individual, the person, and again, what's that look like? That long list of conditions that I was going through. I mean, the classical low thyroid symptoms are constipation, dry skin, brittle hair, thinning hair, loss of hair. You'll see a chilliness. Person will tend to be chilly. They might have a low BP. But constipation, low energy, hair loss, those are kind of your classic textbook low thyroid symptoms that will get people thinking really thyroid. But again, we got that long list of stuff that, you know what, that long list actually also mirrors and exactly matches up with fluoride toxicity symptoms. So if you look in the toxicity reports and you sit those things side by side, fluoride toxicity symptoms with these symptoms of iodine deficiency, which also are the symptoms of low thyroid, all this stuff starts to match up. I mean, if one or two of those things overlapped, I would be like, hey, that's kind of interesting that this overlaps. But guys, the whole thing matches up. So it has to do with toxicity of the thyroid, mineral imbalances, fluoride toxicities, iodine deficiencies. All this stuff is tied together, and it will look, if you're lucky, you'll get diagnosed with a thyroid issue, but very rarely, never, will the endocrinologist connect these dots and go into this deeper dive like I'm talking about to go in and fix this. So what's going on is the docs will tell you your tests are normal, and that's where the person is saying, no, everything's not normal. There's definitely some things going on. So the most active form of the thyroid hormone is the T3. And there's about 20% of the hormones T3, about 80% of it's T4. And here is the key. The T4 has to be converted into T3, which is the most bioactive form of the thyroid hormone, the T3. And in order for that conversion to happen, you have to have some key components that are necessary, essential, required thyroid support. This is iodine, selenium, zinc, iron, progesterone, cortisol, glutathione. This is our list of stuff that we need on board. So those of you guys that have worked with me and we've done thyroid stuff, you've probably seen some of this. I generally don't kind of go this in depth on the thyroid logic. So that again is partly what we're doing during office hours. This is stuff that we just don't have time to unpack this like during clinical sessions. There's other stuff going on, so that's kind of the point. I think it's helpful to understand what all is going on here. So if you're missing even one of these, you can't convert T4 to T3, and instead you're going to have a traffic jam at that conversion, and what's going to happen is you're going to get a bunch of reverse T3. So that's why if we're running thyroid labs and we're coming across issues, I'll do that for a little while and track it. But if the issues do not resolve, usually in under a year, I'll do that and just look at TSH, free T4, free T3. I like to run antibodies too. Make sure there's the anti-TPO and anti-thyroglobulin. Make sure there's not an autoimmune component going on. That's what I'll do up front. And then if we go down the road and things still aren't getting better, we need to flesh out that thyroid panel a little more, and that's when I'm going to want to start to see some reverse T3 and start to look at these levels. That's where we can get basically where all the labs look normal, but things aren't shifting and we still have antibodies. And the thing is, the antibodies, the body will start to, it doesn't, the armor and the hormones and stuff like that, that stuff, the body recognizes that as foreign, and that actually fuels, if there is a Hashimoto component, that will actually fuel that autoimmune reaction. And so the whole thing seems kind of counterintuitive or strange, but this is what actually happens. So that's why, with autoimmune, it'll burn the thyroid out. We have to have thyroid hormone, so you find yourself in a tricky spot where you want to medicate, the thyroid's wiped out. But then the flip side of it is, if we keep using thyroid hormone, what little functioning is left of the thyroid, if we bring in the exogenous hormone from the outside, armor or whatever you name it, the docs are using these days. And by the way, there's huge toxicity issues with those, or plants over in Puerto Rico and places like that where there have been like numerous issues with toxicity and contamination. So that's an issue to set up for reactivity. But then even if it is a clean batch, the body's still going to be reacting to that. So you get yourself in a little bit of a catch-22. You need the glutathione in there that's going to move the if you get all the conversion and you get the T3, then you need the glutathione on board to actually get that from the membrane to the mitochondria inside the cell. And so you need that whole process to be happening. Otherwise, the thyroid is going to go wacky. So iodine, selenium, zinc, iron, progesterone, cortisol, glutathione. If there's liver issues or hormonal issues, lack of cholesterol through improper diet or prolonged vegan diet where dietary cholesterol is not there, the body's not able to biosynthesize that cholesterol. And certainly if there are cholesterol lowering agents, statins on board, you're going to set yourself up for this kind of issue. Because again, if one of these blocks is not there, it ain't happening. It is not going to happen, and you will end up with a thyroid issue. And a lot of times it does end up in this mysterious area, which is no man's land, which is where you're just going to be nursed by the endocrinologist forever. That's no man's land. So I hope this is helping paint this picture. The thyroid is super important. It's a complex process that's happening here, and we got to understand what's going on here. Because then here is the key here, and we're going to pause here after I connect this dot. If you cannot get the thyroid working right, you're going to have issues with the digestion, and then the digestion is going to be off. You're not going to be able to produce the stomach acid, and you're not going to have a functional thyroid system. So if there is a toxicity issue and there's no glutathione, or you're missing some of these building blocks, or if there is here's the real connection with the digestion, you cannot make or absorb glutathione. The body makes it from 3 key amino acids. And you can't make amino acids. Amino acids come from the diet. So if the diet is protein deficient, through a vegan diet or prolonged vegetarian diet that doesn't have these in there, you won't have, you'll get diminished ferritin and you'll have low iron, and that will roadblock the process. But even if we get this far, where we want to, where we have the conversion factors, but we need this glutathione to actually drive the process forward. If the digestion is compromised through low stomach acid or something like that, let's use the stomach acid example, then the body cannot digest that protein down. So 2 things happen. Whole proteins pass through. This is a leaky gut. That sets the person up for autoimmune. It's going to, the body is going to recognize that protein as an invader, and it's going to set up an immune response. That's the kind of one thing that happens. And then the other thing that happens is, since the protein was not fully digested and broken down into the constituent amino acid parts, so the body in its native biology can then go and assemble and manufacture, biosynthesize that glutathione, this process will be roadblocked. So we can use something like liposomal glutathione and try to circumvent that process a little bit, and we'll do that, but know that that is a Band-Aid, and the real answer is we need to get the thyroid on, we need to get the digestion on so that we can be doing this process you know, on its own with the biology. So I think that's a good place to pause. I think that was a good download. There's more to this story, and certainly I could talk about thyroid for a long time, but I think this is a good place to pause here, guys. We're kind of getting to sort of a transition point with the thyroid. So this helps you understand that that the thyroid is a key player in a whole host of diagnoses, many of which are in the chronic disease category. It's the key player and the connecting piece between metabolic syndrome, which again is that connector between digestion and the absorption, assimilation, biosynthesis of all these things. And that the thyroid is a key factor, and we can try to supplement it or even use the pharma, but it's not going to be recognized as native, and it's still going to be an inferior functioning. So we really want to do everything we can to turn the thyroid on and stay ahead of this and prevent the damage and the destruction and the atrophy of the thyroid gland. Now, if for some reason, well, that's a different topic. Let's save that for next time. You guys got it. Digestion, thyroid, all this. That's the office hour session. Okay, guys, so here it goes. What's coming up? These are going to be, if you're seeing this inside the Human Handbook community, wonderful. That's where you guys are getting all the information first. And then we will open this up to, to others later, but we get it first here, and we share it within our community first. So if you guys want to invite anybody into the community, again, we made some tweaks in the network settings, and we want to grow our community. So if you think someone, a friend, a family member, a colleague, somebody would be interested in what we're talking about in here, share the link with them, invite them. That's awesome. What's going to be coming up? We still have, oh guys, we have some really good some new product announcements I want to talk to you about, because one thing that's happened, a lot of our favorite products that we've used for years and years and years have slowly become discontinued, and kind of what's happened, what once were like kind of small mom and pop herb companies are getting bought out by other larger companies like Clorox and stuff like that, and Nestle and big companies like that, and what they're doing is they're kind of phasing out a lot of those products. So that's something that's happening, and so to kind of balance that out, and I think what this is really pushing us to do is to get back into the traditional medicine making and herbal medicine making. So we got some super exciting products coming out. Dr. Jen has some really good formulas coming out for some of our favorites. I have an herbal medicine course that's going to be coming out soon, and Dr. Jen's got her homeopathic course coming out soon. You guys are going to be first to see it inside Human Handbook community, so please make sure you're in there. And I think that's it for today, guys. You guys have a wonderful day. If you have questions about this thyroid thing, I think we could probably talk about this some more. So let's do another session on this maybe next week or the next couple of weeks. This is a good place to start, a little bit of an icebreaker on the thyroid, and again, connecting the dots, everything you need to know but nobody's telling you. Adios for now. You guys have a wonderful day. Dr. Adam Tice signing off. Adios.